Greetings, Integra Therapy family. Hope you're well. This day is wonderful in respect to the fact that the sun is shining, it's warm, and I'm hoping that wherever you are, you're able to find more resourcefulness in all that you're doing, in your working environment, with the people around you, with your environment. If you're joining me for the first time, my name is Andrea Wright from Integra Therapy, and I'm sharing a series of videos to help resource you, give you some ideas and ways that you can connect with your body in a more mindful and specific way. Today I want to talk about knees and our thigh muscles. And this is going to be particularly helpful for those of you who may be experiencing anterior knee pain or pain at the front of your knee. That can be for a variety of reasons. This is one strategy that you could adopt to help you improve the flexibility in your thigh muscles, and also to help relieve the tension that will be certainly accumulating around the front of your knee joint, in the kneecap area. So, as we always have done, let us begin just together, sitting briefly, comfortable chair, with our feet flat on the ground. This is just a very quick way for you to get in touch with your physical body. Now, there are many different ways that you can warm up, but this is just a nice thing that we can do together. Allowing your back to come away from the back of the chair, and I invite you to begin to move your shoulders in one way or another. You're going to move your shoulders backwards. Now you're going to do it in your own time, at your own pace. Then I invite you just to shrug your shoulders as you inhale, and as you exhale, drop your shoulders. And as you drop your shoulders, I invite you to explore your sitting bones, making sure they're well positioned on the seat and beginning to vibrate and allow a wiggle to come through all of your body. Inhaling, exhaling, and come to rest. Now that you have a perhaps clearer sense of your physical body in space, let's begin. So you need to be standing. As I said before, we are working with our thigh muscles here, and this is to help with any discomfort that you may have at the front of your knee for whatever reason in any certain circumstance. So it could be when you're going down the stairs, or when you're climbing stairs, or perhaps when you're sitting at a restaurant, in a cinema, you get that sort of aching at the front of your knee. This is going to be a really good strategy amongst many to help you address this problem. So you'll need a wall, or you'll need a chair to support you. We're going to work with the left leg so you can see. So if you can, you're going to bend your knee and take hold of your ankle, and you're going to bring it underneath your body so that your ankle is towards your buttock. Now, before a lot of you will be familiar with this stretch, but there's a couple of key tips that I'd like to offer you that may make it more effective. You often see people in this position trying to stretch this muscle here, your quadriceps muscle, and you'll see them in this position. Okay, so it's not very effective because the quadriceps muscle crosses the hip. So what we want to do is try to keep the body upright. You may see people in this position trying to stretch, which they will do, but it may not be as effective. If you lift the head Imagine again touching a cloud gently with the top of your head. So you'll see that movement. My chin will come gently in towards the back of my throat. So now I'm in a more upright position. The interesting thing here is that a number of strategies that you can do to deepen this is to gently engage your lower abdomen. You may see that, gently engage your lower abdomen. That already increases the stretch at the front of the thigh. The other deepening maneuver is that you can contract your gluteal muscle. So if you contract your gluteal muscle, notice you'll see my knee move backwards. I'll do that again. Contracting your gluteal muscle. That moves the hip forward, in effect moving the knee backwards. That already has increased or deepened the feeling of tension at the front of the thigh. Now notice here, I'll just turn around, that I haven't got my leg here. Keep your leg midline if you can, with all those other different parameters. If you're able to keep all of those together, then you will feel quite deeply a stretch at the front of your thigh in one particular region. Here you can breathe deeply, 3 to 5 breaths. I would suggest 5 breaths. And if you want to work deeper, what you will aim to do over time is bring the foot towards the buttock, or bring the thigh towards the back body. I'm just going to rest here for a moment. What you may feel is that you feel a strain on your stance hip. That's normal. If you're there for a long time, just release the leg, step, readjust, and then begin again. Now there are 2 more positions that I want to show you, which really make this exercise special. And you'll find a lot of people forget to remember this aspect. So when you're in this position, we'll call it the straight through. What you're going to explore is just turning the foot, keeping the knees together or the thigh midline, turning the foot to the outside, keeping the buttocks squeezed, keeping the lower abdomen engaged, keeping the spine tall. What you'll notice is the line of the pull, the tension will change, and invariably, commonly, that pull will emphasize more on the outside of the thigh. That has a lot more investment in terms of connective tissue and muscles, which often generates more force on this lateral side of the thigh. So often that is a lot tighter. And you breathe here for 5 breaths. Then the other segment is that you move the foot in the opposite way. Again, you may find a line of pull emerge, another line of pull. Again, breathing in the same way, keeping those parameters the same. And then when you finish, you can release the leg. So you can do each of those segments, emphasizing different aspects of the quadriceps in separate movements. If you can tolerate doing them all at once, it's not a problem. If you find, again, your standing leg is straining in the hip, you can rest and go back into them. I would suggest you try this 2 to 3 times a day and see what happens. Make a comment below in the comment box. If you would like to share more of these ideas, I invite you to subscribe to the YouTube channel, and let's share our experiences, what works for us. Let's see if we can develop a community of ideas to help each other with some of these concepts. you're welcome to get in contact with me, Andrea Wright at Integra Therapy, and we can talk about these exercises or others if you're not sure that they are suited for your needs. Be well, thank you for joining me, and take care. Bye for now.